the Maria Holder Diabetes Center. If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
A wonderful Q afternoon, everyone! This is Peter Boyce here, and a special welcome to the Q family! Especially if you are diabetic or pre-diabetic. Do you know why I especially identified you?
I would like to know.
To invite you to listen to the next 15 diabetic-friendly minutes starting up on 100.7 QFM, all being sponsored by the Barbados Diabetic Eye Screening Program, the Barbados Community Foundation, and the Maria Holder Diabetes Center, that beautiful building located behind Eunice Gibson Polyclinic up there in the beautiful Warren, St. Michael, the one place that you can go where every health services which is diabetic related you can find there.
Every diabetic health service?
Yes, every diabetic health service, and you're going to be hearing more about them inside of this 15 minutes. But right now, I want to mention that June is Men's Health Month. So men, if you're listening, this is your month to be focusing on your health. Have you been getting your prostate checks? Have you been getting your eye screened for diabetic retinopathy? If you have had bad circulation, have you had a vascular screening yet? What about the podiatrist? If you are diabetic, have you been to the podiatrist recently and gotten your toenails clipped and your feet serviced? Well, those last three things can all be done at the Maria Holder Diabetes Center. So you can celebrate Men's Health Month by going to Q and the Maria Holder Diabetes Center. Q for your entertainment and the Maria Holder Diabetes Center for your health. And your health is important, men. The women that's like to take care of themselves, and we men have to step up. So make sure and follow the ladies and go to the Maria Holder Diabetes Center. And if you doubt me about the effectiveness of the center, you might be saying, but what does you know, Peter Boyce? You know it's nothing. So what we are going to do is we are going to go to Mr. Dwight Edgell. Do you know Dwight? Dwight is the manager of the Maria Holder Diabetes Center, and he is going to tell us some more about the excellent diabetic services available at the center. Listen, men and women.
The foundation was originally conceptualized to be a one-stop shop. Dr. Oscar Jordan, God rest in his grave, he was the consultant at the QEH, and he recognized this deficiency because, as you know, quite a few Barbadians cannot afford the coverage of care that's required across all the platforms that are needed to treat diabetes. The foundation came into existence because of that. And what we have done, we have built on that platform. We've added so many other different services now. When we started, we just had a podiatrist or a podiatry department, dietitian, doctors, and a diabetes specialist nurse. We have since then added a vascular screening department, a foot screening department, and a retinal screening department. And what we are doing, we are trying to ramp up these services offered that we can now more involve ourselves in the areas that diabetes also affects. So with our eye screening department, we look for early detection for diabetic retinopathy. We have vascular screening, which looks for reduced circulation or circulatory problems. And we do have foot screening, which allows us to get a more in-depth recognition of whether your pulse or the flow of blood in your feet is being affected. And we've only been able to do that because our donors, people who are unsung heroes, give without any reward or notice, and we are fortunate. And what I want to take this occasion to say is that Barbadians are blessed. We have a unit like the Barbados Diabetes Foundation where there's no comparative space like that in the Caribbean, and where people can come free of cost through a referral from the polyclinic. And I'm urging everyone this morning who knows someone, especially people in my age group, the 60s, etc. We may tend to dilly-dally with our health. That early detection is important. And you can go to the polyclinic, have a referral, come to a well air-conditioned space. You have doctors, podiatrists, cardiologists. All these things are provided free for Barbadians. And it hurts my heart when I live in the country. I'm still a barefoot guy. And I hear my friends having, losing body parts, for lack of a better description, because they can take the time to go to the polyclinic to be referred. The government itself has been great because the government is who pays for these services. And I want to, last of all, exhort everyone to avail these things that are for us Barbadians who really can't afford this care anywhere else.
So did you hear all of those wonderful services that Dwight, Edgell, manager of the Diabetes Center, was just talking about? And you heard him reaching out to all the men out there to look after their health? So a Q is good for you, and the Maria Holder Diabetes Center is good for you too. Just call and make an appointment, 417-0305.
The Maria Holder Diabetes Center.
Thank you, beautiful voice lady. Beautiful like the Maria Holder Diabetes Center, who is sponsoring this 15 minutes you're listening to right now. And beautiful like the next lady you're going to be hearing on 100.7 QFM. And she is going to be speaking on something that we do every day, and it rhymes with eat. But it is not eat, it is sleep. Something you should be doing every night. You listening to 100.7 QFM, you need to be getting a good night's sleep every night. And if you're not sleeping well, that's a problem, especially if you are diabetic. So we are going to go to Miss Marsha White, General Manager of the Maria Holder Diabetes Center, and we asked Marsha, how important is adequate sleep to a diabetic? And Marsha said,
super important, Peter. When you don't get adequate sleep, good quality sleep, deep sleep, what that does is it increases your production of cortisol, which is a stress hormone, and the job of cortisol is to elevate your blood sugar. And we know that can affect the way your insulin works. It can make your body more resistant to insulin, and it also, lack of sleep can make you feel out of control. Brain fog can cause depression and anxiety, which will affect your ability to make good decisions when it comes to your diet, or feel motivated to exercise, which will also have an impact on managing your blood sugar. So you've got like a perfect storm there. You've got elevated cortisol, which causes elevated blood sugar, feelings of not being really in control of your own body, and potentially poor decision making, as well as depression and lack of motivation, and then anxiety as well, because you know how you feel when you haven't had enough sleep and you've still got to perform. You kind of feel wired and tired at the same time, and then it's a vicious circle, because you go back to bed the next night and you might find that your level of the cortisol is going to make you feel anxious, as well as having regular anxiety over the fact that you can't sleep and you felt tired and wired all day. It's this sort of never-ending vortex. So it's really important to try to get that back in control, so you can reduce the levels of cortisol, which would decrease the levels of glucose and help you feel relaxed and able to sleep and feeling more energetic, so you would exercise, and feeling more in control, so you make better decisions when it comes to your diet. So you can see how you have both sides of that. What happens when you don't get good sleep, and what happens when you do get good sleep.
Thank you, Marsha, for all those important sleep tips. And I hope the people out there listening to 100.7 QFM, I hope you take heed, because you know all of we need sleep, just like we need to go to the Maria Holder Diabetes Center as we go into our Q song of the day. This one dedicated to all the people, as we say, Peter Boys is big up over using for the radio play all the goldies. Try to play some calypso, man. It's because you that calypso is getting keep down. Well, we're gonna play some calypso. This is Peter Ram with All of We compliments the Maria Holder Diabetes Center. Your chance for all of we to dance on QFM.
You coming at the dance, and you walk up ready, but you ain't bring no friends, nor no family. You see the stranger on your left, you see the stranger on your right. Better start to jam up with them, cause we fucking in here tonight, I'll be chanting. Together we drinking, together we whining.
Barbadians are blessed. We have a unit like the Barbados Diabetes Foundation where there's no comparative space like that in the Caribbean.
Nobody here should whine alone. All of we end up in one place, taking up space. This fetish we hold. Me no want a drama, come to upset me karma. So while you're jamming, I want to hear you chanting. Together we drinking. Together we whining.
The Maria Holder Diabetes Center.
Fret until the morning. Tell me how you're feeling. You know why? All away in the carnival, all away in the festival, all away in the bacchanal, all away. Whatever you get, a wine on your bumper. The crowd push you over, we pushing back. Lord.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off. The Maria Holder Diabetes Center.
Good morning. What's your name?
My name is Samuel.
Okay, so what brings you here today?
Well, I come to get some dressings done on my foot and I had a transmec done just 2 weeks ago. You know, it was infected and I got osteomyelitis in both feet.
Okay, would you like to tell me more about what that means so we understand what's happening?
Osteomyelitis?
Yeah, what is it?
Osteomyelitis is a bone cancer.
Okay.
And it's really kind of stressful. It's not really that painful, but it causes the skin to don't heal around the wound and all of that.
Okay.
So I was on antibiotics, and the antibiotics is only for a 6 weeks regime program, and after that you don't get a break. It just don't work.
Okay.
So I was on the antibiotics, and it wasn't working. It was from level to augmentin to ciprofloxacin to all of that stuff. And when it boiled out, it still boiled out to amputation. High morning. So I'm now recuperating from the amputation.
Okay, so how long have you been living with diabetes?
Well, close to 30 years. I think I was diagnosed close to 30 years ago.
How old would you have been then?
Around 24, 25.
Oh my goodness, so type 1 diabetes.
Yes.
Okay, and how long have you been coming to the center?
Well, it's just over a year now, but it could be about 15 months, a year and 3 months or something like that.
Okay, and how did you find out about us?
Well, I was recommended here through the polyclinic, the USCSM polyclinic, because they seem to kind of get my condition managed. So they say the best place for me to go then is the Diabetic Center, where they do a wonderful job of welfare.
Okay.
And I've been here for the past 15 months, and I totally appreciate your service. You all do a wonderful job here, and you're all courteous and kind.
Okay, I'm so happy to hear that.
It's the truth.
I'm so happy to hear that. Thank you for taking the time to share your story with us today. Thank you so much. Bye.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments, the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier easier to reverse diabetes. Certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care.